Hi everyone, I'm Brittany with slpmaterialgirl.com, here to talk about attention deficit hyperactivity disorder. I am a licensed speech language pathologist and I'm accredited with ASHA. I want to talk today about the definition of ADHD, the characteristics, and the causes. Let's take a look at this comic. It's by ADHD-alien.com. Really cute, and I think it does a wonderful job of explaining what it feels like to have ADHD. So here is, I actually want to look at let's look left to right. What is it like to have ADHD? You're not able to control what you concentrate on. So in this comic, this little girl is looking at this pattern on the wall and it says, oh, that pattern looks like a dog. So she's supposed to be concentrating on, whatever piece of homework or, work is in front of her, but she's concentrating on this pattern. And it is also involuntary daydreaming. So she's thinking about ice cream, her dog at home, maybe her best friend, and she's daydreaming here. Here is what some parents, teachers, professionals, and even people who have been trained in understanding ADHD, what they assume. They assume she's purposefully not concentrating, and they assume she's unwilling to try. So they do not see, they may even know this student is positively identified as having ADHD, but they're assuming that she's purposely not concentrating. They're going to punish her for not concentrating. They're assuming she's a, quote, bad kid, unwilling to try. But this is very far from the truth, very untrue. It's easy to fall into this mistaken way of thinking. If you've met, and now here's another thing. This saying is usually applied to autism, but I think it works for ADHD as well. If you've met one child with ADHD, you've met one child with ADHD. And the reason I'm saying that, I'm saying this is what it's like to have ADHD for this person. And I think a lot of people this would resonate with, but everyone's an individual and should be viewed holistically and, for their own special uniqueness and their own, special way of dealing with things. But this concept of the bad kid, I want to get back to that. I've met many children with ADHD that the teachers or the assistants will come up to me and say, he's just a bad egg. He's not concentrating. He's not working. I have to, if I've yelled at him once, I've yelled at him 100 times, or if I've told him to focus, I've told him to focus 100 times. And that is not viewing the child with the lens of understanding the nature of their disorder. So that's what I want to do today. I want to demystify ADHD a little bit, and I want to explore why this is a good kid. We just need to set them up with the tools to succeed so that they can focus and they're in an environment where they can succeed, where they can learn, where they can combat these social and academic issues that they're having caused by their ADHD and their, even occupational issues they're having because of their ADHD. So let's start off with the DSM-5 definition of ADHD. It's a persistent pattern of inattention and or hyperactivity, impulsivity that interferes with functioning or development. To fit the diagnostic criteria, you must exhibit 6 or more of the defined symptoms of inattention and or hyperactivity and impulsivity, and then the symptoms must be present for at least 6 months and be atypical compared to one's peers. So this saying right here, atypical, because we all daydream, we all sometimes have trouble concentrating, focusing, but not to the degree that someone with ADHD would have. Theirs is atypical. It's truly interfering. It's negatively impacting their social, academic, and occupational activities. So it's significantly impacting them. The gold standard for clinical assessment includes behavioral observations, ADHD rating scales, global impairment measures, and also standardized tests such as the Schedule for Affective Disorders and Schizophrenia for School-Aged Children, present and lifetime version. By the way, I do want to put a little disclaimer in here. As an SLP, I do not diagnose ADHD. I think it's good to be informed about attention deficit hyperactivity disorder, because when I do have a student that has that, I'm gonna write my treatment plan different. But I do also view whatever speech and language deficits or disorders they are presenting with, I'm going to treat. But it is good to know and be informed of ADHD because I can make more informed decisions about my treatment plan. But I do not diagnose ADHD. I believe, do I say it right here? I say it in this little box right here. Oh, maybe I don't say it. I believe psychologists and doctors are the ones that diagnose it, but you could do a simple Google search and figure that out. Characteristics of ADHD. It's characterized by executive functioning deficits. So primarily response inhibition, working memory, and overall weakness in executive functioning. So what does this kind of mean? Response inhibition. Basically their ability to inhibit certain behaviors. So let's say they're the student sitting in the classroom. That impulsive act. They may have impulsive acts, or they're unable to, or they have trouble. Some individuals with ADHD have trouble regulating their impulses. To go, like, let's say you're trying to focus on reading a story with an imaginary, let's say a hypothetical student with ADHD, and they're losing focus in the book because they're focusing on what the other group is doing or whatever the other students are doing or what's going on outside. And they may even abruptly say, hey, what are we doing later today? They didn't turn that impulse off that this is not the time to ask. We're in the middle of a story. We're reading the story. They didn't have that appropriate, response inhibition. And then we have working memory, and then just an overall weakness in executive functioning. So I think, I talk a little bit more about it here. So here's the different buckets: organizing, prioritizing, and activating to work, sustained attention, regulating alertness, managing frustrations, regulating emotions, utilizing working memory and accessing recall, and monitoring and self-regulating actions. So that's more of that impulse. So these are Brown's model of executive functions impaired in ADHD. And that's said to be, I believe it's said to be like the root cause of ADHD. But there doesn't appear to be a single region of the brain whose impairment definitively differentiates the brain of an individual with ADHD from a neurotypical individual. And it's characterized by multi-system structural and functional brain abnormalities. So basically what I think this is saying is we don't know. I think it's widespread small brain differences. This is my opinion, based on what I've read. Small brain differences, and it doesn't seem to, like, we can't localize one area of the brain. We can't say, oh, this person's frontal lobe appears to be, different structurally in this way, so that means definitively they will have ADHD. We can't do that. That's not true. It's a multi-system structural difference, or they're using the word abnormality, but I think difference is equal, says that. Areas of the brain affected. So that has been linked specifically to the cerebellum, the gray area, and the white matter in the pons. And then also norepinephrine and dopamine levels. But if you looked at the brain of two individuals, it's not going to be across the board. Like they were both caused in the area of the cerebellum. They were both caused in the gray matter of the brain. Like I said, I think sorry about that. My mic got away from me. It's like I said in the previous slide. It's not one single region of the brain, and in everybody it's going to be different. It has been, believed to be the result of a deficiency in those neurotransmitters, and that is one reason that medication has been proven effective with some individuals, but it's a case-by-case basis, to my understanding. And then there is some familial inheritance that's seen. This is interesting. A parent with ADHD has a 50% chance of having at least one child with ADHD. So mom has ADHD. She has a 50% chance of having an offspring with ADHD. And then a mother with ADHD shows a stronger inheritance pattern than that of the father. So I actually wish in this little chart that it was mom has ADHD, and then she has one child with ADHD. Let's pretend this is actually a daughter, because the way this goes, mom will have a stronger inheritance pattern than dad will. So let's say this is mom has it, and then mom now has a 50% chance of having children again with ADHD. So she had two children, one had it. We're pretending this is a she has 4 children. 2 of those children have a high likelihood of having ADHD. Now there is some inheritance pattern with a father, but it's stronger with the mom. Strong association between ADHD and neurological disorders has been found. So if mom has it says if a parent, it just says parent. If a parent has an adult onset psychiatric disorder, the child has a higher chance of being diagnosed with ADHD. So if mom or dad develops bipolar disorder, depression, anxiety disorder, personality disorder, as an adult onset, it increases the likelihood of having a child with ADHD. Oh, and that's actually it for this presentation. I just have a little disclaimer at the end here. It was generated during this is actually part of a greater presentation, but it was generated during my graduate study research and, edited a little bit my own clinical experience. If you agree or disagree with anything I said today, probably especially with that widespread brain region little bit I just did, I'm going to be honest. I'm less informed in that area about the differences in the brain affected with individuals with ADHD. Or if the beginning part resonated with you, this little comment, if you want to post a comment, talk about something you agreed with, disagreed with, I'm a lifelong learner. I'd love to hear your perspective. If you have ADHD or if you have a child with ADHD, I'd love to hear what you have to say. And also the intention of this video is not to provide therapeutic intervention. I'm not providing medical advice or treatment, and anybody listening is to use this information at their own risk or discretion. Do your own research. I did cite my sources, so if you want to look up these groups to do your own research, I highly encourage that. Thank you for sticking with me today. I hope that you learned something. I hope I can learn something from you, and I'll see you next time. Bye-bye.